Hello and welcome to the 2024-2025 school year at West Fargo Public Schools. Through this informational and training module, we hope to provide staff with insight into the role of a school nurse, as well as how every staff member can assist with ensuring all our learners are safe and healthy at school. West Fargo Public Schools employs 19.5 nurse FTEs, including a lead nurse for our 23 schools. In addition to the names shown on this slide, the district had one open position as of the recording of this video in June 2024. The district's nurses are scheduled based on the daily required medical cares of the learners we serve, which means that some schools only have nursing services for a portion of the day, and other buildings are served by multiple nurses throughout the day. It is these scheduling limitations that make it critical for all staff in our schools to have a basic understanding of the information included in this video. So, what do our school nurses do? At the beginning of each school year, the nursing team reviews all learner records to determine needs identified through the health questionnaire completed during registration or in an IEP or 504 plan. They review the immunization status of learners and communicate any missing vaccinations to families. They educate and communicate with staff regarding the needs of learners in their classrooms, as well as coordinate and communicate with families to ensure a comprehensive understanding of the learner's needs. Every day, our school nurses assess, treat, and monitor learners based on acute conditions, administer medications, both on a scheduled basis and as needed, and carry out needs identified in care plans for learners with chronic health conditions like diabetes, seizures, and asthma. In collaboration with other district staff and/or outside agencies, they can conduct eye exams, provide mental health supports, initiate referrals to social services, distribute supplies to staff for use in classrooms, and prepare for medical needs that may arise on field trips. Our nurses also stay on top of infectious disease trends and specialty procedures for chronic health conditions. While hopefully the least utilized skill set they offer, the school nurse is also a critical part of a school's response to an emergency situation. To ensure that all learners are receiving the maximum educational benefit from their time at school, all staff must work together to ensure that learners remain in the classroom as much as possible. To help with this, remember the 8 B's and the 20-minute rule. If the condition the learner is exhibiting is on this slide, they should be evaluated by the nurse. If it's something else, we ask that the teacher wait 20 minutes to see if the issue resolves itself, which it often does. If any of the conditions listed on this slide exist, or if you simply aren't sure, it's best to call 911 and seek professional assistance. 911 should also be called when the learner's condition is life-threatening or has the potential to worsen and become life-threatening on the way to the hospital. All district staff, not just the principal or the nurse, are empowered to call 911 when they feel it is in the best interest of the learner. While our nursing staff will educate and communicate with staff regarding the needs of learners in their classrooms or on their caseloads, teachers can also pull learner medical reports themselves, either by classroom or by student. Now that we have given you the general overview of the nursing program, let's dive deeper into some of their major portfolios, including how you can assist. First, we'll review medication protocols. There are both district-provided medications and those that are provided by parents and guardians. The school nurse has limited medications on site and available for administration to learners with parent and guardian permission. As shown on the slide, there are differences by level for what is available. Schools may only administer the manufacturer's recommended dose to the student. They can also only administer medications provided by the nurse. Schools cannot purchase alternative medications, including liquid versions, cough drops, or cold symptom relief medications. District policy requires the completion of the medication administration form for both prescription and over-the-counter medications. Any medications administered at school must be submitted in the original container. Learners may wish to self-administer their medication, which is allowable only after receiving an authorization from their healthcare provider. The authorization must indicate whether the learner is authorized only to self-administer or to carry and self-administer. The next portfolio to cover is allergies. While not all allergies are life-threatening, it is imperative that we know how to handle those that are. Anaphylaxis is a severe, potentially life-threatening allergic reaction that can occur within seconds or minutes of exposure. While there isn't always an obvious trigger, common ones are food like nuts, milk, fish, shellfish, and eggs, or insect stings, particularly from wasps and bees. Common signs and symptoms of anaphylaxis are shown on the screen. They may come on suddenly or intensify over time. If you see a learner or staff member exhibiting symptoms of anaphylaxis, act quickly. EpiPens are located in the office as well as in AED cabinets. Learners with known severe allergic reactions may also carry their own EpiPen. If you've never used an EpiPen, this brief video walks you through the simple process. Please click play. On to asthma. The severity and frequency of asthma attacks varies greatly by learner. In this section, we will cover general signs and symptoms as well as when to call 911. If you have a learner who is having difficulty breathing, complains of tightness in their chest, or is audibly wheezing, contact your building's nurse. Encourage the learner to remain calm. A great trick is to have them breathe slowly in through their nose and out through their mouth. The district requires an emergency care plan to be filed for learners with asthma. This plan will indicate the usual triggers for their asthma to flare up, whether or not they have a rescue inhaler and where it is kept at school, and when emergency treatment should be sought. In most instances, a learner can get their asthma under control by use of their rescue inhaler. Monitor them closely after use of the inhaler to ensure their symptoms are improving. The next portfolio is seizures. If you have a learner exhibiting seizure signs or symptoms, immediately contact your school nurse. Place the learner on their side on the floor. Do not use a pillow or restrain them in any way. Remove objects near to them to avoid injury. Do not place anything in their mouth. If a learner has an emergency care plan, refer to that document for their emergency medication and other procedures. Note the time the seizure started, as well as any movements and/or loss of consciousness. When a seizure lasts longer than 5 minutes, the learner has multiple seizures one after the other. If they're having difficulty breathing or they've never had a seizure before, call 911. If the learner stops breathing while seizing, start CPR and call for the AED. Some learners may require the administration of emergency diastat to control their seizures. Please click play on this 90-second video to observe how to administer diastat. The final health condition we're going to touch on is diabetes. A team approach is needed to ensure each diabetic learner's individualized care plan is met. When this happens, these learners miss less class time, have fewer sick days, and have the support necessary to maintain healthy blood glucose levels. Diabetic learners may display the listed symptoms when blood sugars are not being tolerated at a too high or too low level. If a learner is exhibiting any of these symptoms, please assist them to the office for further care. If a learner becomes unconscious or unresponsive, is unable to speak, or has rapid breathing, check their blood glucose and call 911. Follow their emergency care plan until assistance arrives. While not specific to school nurses, the district partners with Fargo-Cass Public Health to provide Narcan at every school facility, stored in the AED cabinet. Narcan temporarily reverses the potentially deadly effects from illegal and illicit drugs. Overdose can occur within minutes. When you see these symptoms exhibited by a learner, it is crucial that you act quickly. Even if you aren't certain it's an overdose causing the exhibition of the listed symptoms, Narcan can still be administered without harmful effects. Narcan nasal spray can be used successfully by untrained individuals in high-stress situations and requires no preparation aside from opening the package. The instructional card shown on the screen is included in every package of Narcan that the district has. While hopefully few and far between, emergencies do happen in school settings. We are lucky to live in a metro area with quick access to first responder services in addition to our own district nurses. In extreme situations, when the individual is unresponsive, not breathing, or not breathing normally, direct someone to call 911 immediately and get the AED. Start CPR and follow the instructions included in the AED kit. As a staff member, you need to know where your building's AED is located. If you don't know, please ask after completing this training module. The last portfolio covered in this training module includes 2 general wellness practices for your awareness. When learners become sick at school, they are taken to the nurse's office for evaluation. The nurse will use their professional judgment and the guidance from the North Dakota Department of Health to determine the best course of action for the learner. If the nurse sends the learner back to class, a note will be sent to the teacher explaining the rationale. The district has adopted a no nits practice when dealing with head lice. Learners with nits or head lice will be removed from other children. The child's parent or guardian will be required to pick up the child from school immediately. This completes the training module for health services at West Fargo Public Schools. If you have questions about assisting with a particular learner on your class roster or caseload, or have general school health questions, please connect with your school nurse. There is also additional information on all subjects covered in this video on our website. Visit Health Services under the Families tab. Thank you and have a great year.